What are the broad categories of clinical trials currently underway for AML and MDS?
In the last couple of years, 2-3 years, there are several newer treatments being approved in AML. And AML is such a devastating disease, especially for the older population. Most of the times, we don't have too many options in the past to treat. And most of the patients who are elderly may not be able to tolerate the chemotherapy and other treatments that we offer. But in the last 2-3 years, there are several new drugs approved. For example, CPX351 is a new drug approved in AML in 65 or older patients for AML associated with MDS related changes. And last year there is an approval for hypomethylating agent with venetoclax that kind of improved the response rate and also actually survival in this patient population. So these drugs are already approved, and right now I'm excited to say that we are testing other drugs in combination. We are trying to improve upon, compared to what we were able to do in the last 4 years. I mean, there is significant advance by addition of like either CPX or venetoclax, and there are other targeted drugs being approved, like FLT3 inhibitors, for example, and also IDH inhibitors are also approved in AML. So what we are trying to do in MDS is trying to replicate the success of what we had in AML in MDS. So we are trying the similar drugs in MDS also. We have to see how that goes, and there are particularly one drug that I'm interested in. That we are already participating in LCI is a CD47 antibody. It blocks the interaction between macrophages and leukemia cells, and it seems to be promising in the early clinical trials. Already phase 1 and also phase 2 is being done, and so that is another area I think it's going to be exciting in the next few years.